Yeah, hi. Welcome to the webinar on blockchain in healthcare industry. I myself, the speaker today is Junaid. Now we have gathered over here for the scenario. So first of all, I would like to share my screen. So first of all, very first again, welcome to a webinar on blockchain in healthcare industry. Now, we today, first of all, we are going to discuss on to the main topics about what is the blockchain. We already have seen about the terminology about the blockchain. We already know how it's going to work onto our real-time platforms, right? So now we are going to start the webinar. But before we start the webinar, there are some general instructions are there. If the webinar is running and if you are facing any of the query, then please note it down that please write it down onto the chat box available onto your right side panel. And one of the most important recommendation is that please do not use your mobile when webinar is running. And my deeply recommendation is please keep silent or switch off your mobile. So thank you very much. So now let's see what are the agendas for today. So first of all, starting with the webinar, the agenda that we are discussing is the first thing that we will see today is introduction to the blockchain. So now the first thing we will see what is a blockchain, why we are using the blockchain, what are the scenario for the blockchain, and based on that we are going to see some of the concepts regarding healthcare. Now, healthcare is like as we see when we go to any of the hospitals or to the pharmacy store or to the laboratory. So these are all the terms which are related to healthcare. So we will see the examples of that what is healthcare, and we will see about the blockchain. Then we will understand what are the inefficiencies caused into the healthcare. Now, inefficiency in the terms of when we are not using blockchain. So, what are the problems that can be occurred when we are not using the blockchain? So, we will discuss on that part. Then we will see the scenario of the blockchain completely into the healthcare. So, we will combine the complete healthcare solution into the blockchain. And then the topic that we will see is about the building blocks. Now, what are the building blocks means what are the terms and terminologies used in the blockchain. So that is a scenario about how it's working. And lastly, we will try to see some of the projects that have been undertaken or have been undergone into the blockchain specifically for the healthcare industry. So this will be the complete agendas for today's webinar. I hope you will enjoy the webinar. So now, without taking the time, I will now start with the introduction to the blockchain. Now, when we say about the blockchain, so first thing that comes into the mind that blockchain is a terminology which is working in a network. Right. Second, we can see the blockchain can be considered as a scenario like how it's working. Okay. So I think the many participants are over here. So I just want to ask that do you want to add something into this blockchain? If you have any of the idea about that how it is blockchain, then please. Okay, so I think the simple thing for the blockchain is that blockchain is completely dealing with the completely informative information and which are having different networks, different platforms, and we can make the same blockchain for mobile as well as web-based application. So now we have seen there are multiple definitions of the blockchain and there is no specific defined term for the blockchain. So there are a large number of definitions for the blockchain, right? And now simply if we say that blockchain is completely peer-to-peer distributed ledger. Now peer-to-peer, which means that all the systems, all the nodes, all the computers are connected to a node network within one single node. So that node which we can consider as a blockchain. So now in simple term we can say blockchain is a peer-to-peer distributed ledger that is, so how they are. So first it is cryptographically secure. Cryptographically secure, which means that let's say there are two users. Now one user wants to send a message to the another user and the message is, let's say, hello, how are you? But they do not want to use a simple text, so they will encrypt their values. So that encryption and the decryption of the message is called cryptographically secure. So all the message will be completely in hash based value. So first point that we need to understand is that blockchain is completely and cryptographically secure. Second thing, it's append only. Let's say we are working on any of particular point. Let's say something menu or forms that we have created. Now let's see if we want to add something. So then we can also add some of the additional fee functionalities to the blockchain. So that functionality will be visible to everyone. Okay, so that is an append only. Then the third thing comes into this is one of the most important, that is immutable, which is the thing like that once you have created your application, or we can say the one functionality of the application, and sometimes it happens that if you want to make a change into that particular platform, then it becomes sometimes immutable because we need to perform the complete secure operations, secure logging functionalities and everything. We need to perform it again. So it might be very helpful also because everything is completely secure. So that is an immutable is one of the most important thing. And the last one is about consensus or agreement upon peers. So now if we want to update any of the modification, then the first thing that we need to do is to make one consensus. So consensus is nothing but the in simple layman term we can say rules and regulations for the particular applications. Okay, so now that is called consensus, and there is complete agreement is being done between all the peers which are available onto our blockchain network, right? And lastly, we can say it is nothing but the layer of distributed peer-to-peer network running on the top of the internet. So when we say running onto the top of the internet, which is on one of the most leading platform of the blockchain. So I think this is a small overview of about the blockchain. So do you have any of the questions on any of this particular slide? Okay, so let's move further. Now we are going to see the blockchain process. We have seen the definition of the blockchain. Now I would like to share you the blockchain process. Like first one, let's say simple example I'm showing. I'm not going to show the example of healthcare right now. Right now we see about what is the blockchain. First one, let's say A he wants to send a money to B, right? So now what will happen? The money which is being sent from one sender to another sender receiver. Okay, so that transaction, as you can see on the number 2, it is represented as a block, right? So block and chain, block plus chain. So whatever the things you do, whatever the transactions you do, whether you send, whether you receive, whether you update, whether you make a change, everything is represented as a block, right? Now Once you have made a transaction, so now that will be our block. So you can see on number 3, that transaction is now broadcasted to a network of the nodes. So now that block is between the nodes which are into the network. Clear? So now that transaction will be seen by all the nodes. Now, once the transaction has been reached, we need to validate the transactions which have been came from to the network. Right? We have a transaction, that transaction converted to block. Block is being moved to the network, and then all the networks will nodes will validate the transaction. Once it is validated, so you can see on the 4, once it is validated, it will move to the blockchain. So multiple blocks will be available, and that multiple blocks is represented as a blockchain. Right, so this complete scenario, and we can see that A money has been moved to B. So this is a complete scenario of the blockchain process from step 1 to step 6. So you have any of the questions on this particular slide, or you can ask me without any query, please. Okay, so let's me just move ahead. Now, we first of all we need to understand healthcare. Healthcare we already seen. One of the most important, that see, healthcare is a very large term. It cannot be. It has many terminologies like patient, doctor, staff, non-technical staff. Then they have the nursing facility. We have a laboratory. We have the patient laboratory list. Insurance companies and insurance companies there. So there is a healthcare in the terms of many relationships. But first thing that comes into the mind is patient and doctor. So first of all, I want to know that can do you have any idea about what is the health care? If I'm missing something, then you can just come and let's have some incubation on what is health care. Okay, so now if we talk about healthcare, then between the patient and the doctor, so you can see onto the diagram. Now we are completely seeing there are 2 points: patient and the doctor, right? So first thing is the patient, because doctor is not going to fetch the patient. The patient is only the person who is going to the hospital. Now the patient will move to the hospital if he's having any of the disease or any of the things that need to understand. So now first of all, the patient will have his own prescriptions. Let's say what are the diseases he's facing, what are the things he wants to face. So first of all, the first step is that you can see onto the screen is a consulting fees. Now the patient will move to the doctor by paying his consulting fees. Right. Now the doctor will have 2 things in his mind. First, he will have his physical records, means what is the disease, where is coming from how many days he is facing the disease, what are the steps for that one. And that physical records, that is the physical records we can represent with a pen or paper or something like that one, and that it is being converted into the digital records. Like it can be written in text format or something format into your system. So that is called a digital records. So now, once the disease has been identified, if some long disease is there, then he have an insurer, right? So once the doctor has been prescribed, everything, the consultation will start with the patient. So doctor will consult the doctor will consult the patient with what is his diagnosis, what he has been diagnosed with, what are the orders, what are the treatment plan he needs to perform, and what are the prescriptions he need to follow. Now, all the things has been done, then the patient will be available with the insurer. Yes. Okay. So that insurer will see that what are the diseases here, what are the phase points that has been noted out by the doctor, and based on that, that the insurer will claim that particular bill, and then he will pass that particular insurance claim statement to the patient. So now this all the scenario will be working between the patient and the doctor. Now, so do you have any other questions on this particular patient and the doctor? Okay, so now I think let's move further. Now, I'm going to show you one more example between the relation between the patient and the insurer. Now, the patient and insurer is also very most important thing, because the insurance company are generally using the patient for their getting the insurance and helping them in that particular part. So now, patient and insurer. So this is example. First one, the patient is having its own claimable bills, right? That what are the disease, what are the steps he has gone, what are the medicines he got, what are the laboratory tests he has undergone. Everything, every information he will having by one employer. Now, he will, based on his disease, the premium will be raised. That how many amount of what amount he is being raised, and that amount will be passed to the insurer. Now, insurer will check laboratory statement, hospital statement, the doctor statement, and the pharmacy statement. So everything details will be available, and he will check that how much total amount has been claimed. And then once it is done, that statement will be claimed to the patient, and the patient will have his own claimable bills. So this is the complete scenario of about the patient and the insurer. So I think, do you have any questions on that particular part, or I think we can move further? Okay. Now let's move further out. So now let's consider that blockchain is not into the picture. Then what are the efficiencies which can be caused? The first efficiency is operational inefficiency, which means that something that the patient comes, then he might not be aware that what he can do. Then the doctor will be not be able to understand that. So every scenario will be onto the physical records only. The patient comes today, and then they will forget everything, that what was the disease and who was the patient, where he came from. So that types of efficiencies are being recorded. So that is operational efficiency. Then, based on that, we have a delays. So there must be delay will be there, duplications will be there, and inconsistency. Duplication in the terms that, consider one patient has already arrived, and after 1 year is coming again. So they don't have any of the record, and then the doctor will ask again that whether you have been passed from any of the disease. Okay, so that might be the cases happen. So that is the inefficiencies which is not being caused, right? And if it is in the blockchain, then everything will be completely into the records will be available, and the doctor can easily see the complete history of the patient. The frauds can be done, like say, the for diseases, basically for the insurance, the let's say insurer is there who is working on that particular platform, then there also the fraud can also be happen. Then negligence and errors may be there, might be some error in the name, age, or disease, or some medicines, or everything, anything can be happen. So there can also be happen negligence and errors. Then tampering and mishandling. Mishandling in the case that that might happen that the patient is facing with some disease, and he is being diagnosed with that some different medicines or the disease. So that chances can also be happen, and compliance requirements is also required. And multiple service provider means that the questions comes that multiple disease diagnosis has been happened. So he might be having multiple options, like which insurance company he should go, which laboratory he should go, which laboratory test he need to perform. So all these queries usually comes into the mind, and he will be stuck into that particular part. So sorry. So this is the thing where happens when working with the in terms of blockchain when we are not using. So any questions on inefficiency? Okay. Now, simple scenario, I'm going to explain you about the blockchain. Okay, so you can see on the left hand side we have the patient, and then we have the terms with whom we are authorized. So authority is there, insurer is there, doctor is there, laboratory is there, pharmacy and insurance. So now the patient will interact with all these particular purpose. Now each and every person will have their own digital records. So this is in the terms of blockchain, right? So first step is that the patient will join the network, joins the network, which means that he arrives into the hospital. So the reception will be there, registration will be done, and that he will pass to the smart contract. Now what is the smart contract? Smart contract is nothing but if we want to make any of the rules and the regulations or the some coding or some everything, that can be done with the help of the smart contract. Now, as you have been subscribed for this blockchain webinar series, so these smart contracts are being created using Hyperledger framework, right? So this will come into the third series of to the third part of to the blockchain webinar series, that is called Hyperledger framework. So at that webinar, you will see the how to create the smart contracts. So inside the smart contracts, the details like patient unique, name, age, and everything will be available. So that is the scenario. And then once the detail has been done, the patient will purchase the insurance, and then insurer will be done. Then they will consult the doctor. Doctor will have his own consultation, and he will show his details onto the smart contracts. Then laboratory, pharmacy, and insurer. So you can see from the left to the right, everything step by step process is being done for the blockchain framework for the healthcare platform. Clear? So this is the scenario of how the blockchain is working. So any question, because this is the most important slide that we need to understand. Okay. Yes, exactly. So I would like to have one question has been raised. So I would just like to inform that digital records are nothing but the thing that we use into the software or the web application or the mobile application are being stored physical, because physical records will not be available in the blockchain platform. So that is the thing that we are only using digital records. Okay. Yep. Okay, so now we are now going to see what are the important blockchain building blocks. Building blocks, which means that what are the important points which come into the scenario. So if we see who are the use cases, so we can see EMR management is there, claim settlement is there. So what are the terminologies, what are the things can be done? Now, what are the advanced analytics? Predictive, medical image processing, descriptive analysis, automated. So everything will be available in advanced analytics. And in the terms of healthcare, medical checkup will be there, telemedicine will be there, public health surveillance will be there. And if we come to the middle of the image, we will see the block core services. So we have a smart contract, we have a distributed ledger, we have permissions, wallet. In the wallet, if we talk about the wallet, that will come in the Ethereum in action. The second webinar that we are going to see out of the series is Ethereum, how to create the wallets, right? Then we have components like standard vocabulary, resource instance, cloud infrastructure. So this is a complete scenario. This is very detailed blockchain building blocks. So this is the complete scenario that how it's working. Clear? So any question on this particular building blocks? Okay, let's move forward. Now, I would like to show you one of the 1 to 2 slides that we have worked onto the projects. So this is one of the example of the patient. So now the patient, you can see that what are the new patients is that how you can see on the left hand side the menu, appointment with doctor, pharmacist, order medicines, laboratory, everything is available. So this is one of the leading projects that we have undergone into the specifically onto the healthcare, right? So this is the thing. where can this we can work on. This is a patient, and then the patient will have the complete one more detail onto the, he can use the book laboratory list. So you can see the patient can see that what are the laboratory details. He can see, like he can consult which doctor, which facility is being available, whether he wants to visit his home or not. Everything has been done onto that particular platform. And then we have one example of doctor who is having the, whose patient who is working on which possible disease. So this complete details have been working on. So now this is the example of the projects that we have worked on. So I think that's it for the webinar for the first series. And you, if you have any of the questions, then please feel free to ask. Okay, it seems that everything is clear. Thanks, everyone. And one more thing that I will need to show you one thing is that thank you for registering to the first webinar. So now the upcoming webinars will be Ethereum in actions, where you will find how to make the wallets, how to make the application. So we will see some of the short descriptions about how to work on that. And the third webinar will be on the Hyperledger framework, where we will create the smart contracts. Okay, so this is a complete webinar series, and hope you have enjoyed this particular webinar series. And I will consult you to please contact your friends and your colleagues to participate in the upcoming webinars. And we would like to thank you very much for this complete your support. And thank you very much. See you.